This is Living Healthy with Jackie Bell, the show with the information on health that you need to know from people you can trust. Brought to you by The Woman in You.
Hi, welcome to Living Healthy. I'm your host, Jackie Bell. Today we'll be talking about our feet and the role they play in the overall health and well-being of adults, children, pediatrics, and diabetic patients. Our guest is Jeanna Polonchek. Dr. Polonchek received a Bachelor's of Science degree from Indiana University, a Master's of Science degree from Syracuse University, and a Doctor of Education degree from Boston University. She is a licensed and certified athletic trainer, strength and conditioning specialist, certified pedorthist, and a surgery certified orthopedic technologist. Jeanna currently works at Wareham Orthopedic Associates, and she is the CEO of Soul Remedy LLC, Custom Orthotics and Foot Care. Jeanna has 28 years of experience in the sports medicine field, with experience for caring for Olympic, professional, collegiate, scholastic, and recreational athletes. Welcome, Jeanna.
Thank you. I appreciate being here.
Tell us how you became interested in orthotics, how you developed such a passion for it.
I think it all started as an athlete, honestly. I was pretty interested in how the body moved, and as I went to college and studied anatomy and also continued my athletic career, and had some injuries along the way that brought attention to my feet. And so from there, and being in the field and working with Wareham Orthopedics over a number of years, I developed a keen interest in the foot and how it works, and seeing how the injury problems that people have are actually related to their feet.
And so how are the injury problems related to the feet? Because we talked about the way that a foot lands, then that energy, moving up the leg and into the hips and spine.
You're exactly right, and the reality is that the foot, there are a number of different foot types. Generally speaking, there's about 24 different kinds of foot types, and everybody has a different characteristic to their feet. And depending on what the foot type is, they're going to be prone to a number of wear patterns or gait patterns, callus patterns, for example. So there's a lot to be told about sort of the wear and tear that your body might incur based on what foot type you have. And actually, your foot type is inherited. So it's not unusual to compare relatives in your family and realize, oh my gosh, my feet look very similar to some other relative in my family. And there's a reason behind that.
And so when you categorize someone's feet, select basically what type of foot that they have, are there certain potential injuries that they could have physically that you would be able to then offset using the orthotics? Absolutely.
For example, somebody who's got a very high arched foot, because of that high arch, I have my model here, and if we look at a foot, somebody who's got a very high arch and a foot that in this position, the ground actually reacts to that foot, and they are kind of put in a position that preloads their ankle for a lot of potential ankle sprains. So that's one example of somebody with a high arched foot. That high arched foot also is not a very good shock absorbing foot. So they have a lot of tendinitis problems. So there's a number of different things that can happen for the high arched foot. On the contrary, if somebody's got a very flat foot, because of the flat foot position they are very prone to a lot of tendon failure over time, because with the arch collapsing like that, there's a lot of excessive stress and strain on certain tendons that help support or create the arch. And over time, the decades of wear and tear, normal daily activities, those tendons can become inflamed and irritated, chronically overused, and ultimately end up failing. And that's a big problem, because when the arch collapses, there's a lot of things that can go wrong with the foot. The low arch individual has a lot of pathology in their foot type. And what happens is that we talked about the normal gait pattern, the heel strike, mid stance, and then the toe off. And a toe off should occur at the ball of the foot. In a flat flat-footed individual, what happens is right away from heel strike, their heel will start to kick to the outside, and then they'll kind of flare their foot out in that wider angle of stance, and then their arch will tend to drop a lot, almost to the point of being completely on the ground. And then instead of toeing off in the ball of the foot, that foot starts to break down in the middle, and we call that the lesser ankle joint. And that can be very damaging because the foot has got 26 bones and 33 joints in it, and in between those bones there's a lot of motion which creates the arthritic changes that happen over time. So that's a very problematic foot, and if they don't have any more room to flatten out because they're completely flat on the ground, the other thing that'll happen is that they will start to borrow motion at the ankle. So you get this shifting of the ankle too, and that's why sometimes those ankle bones look like they're really wide or thick in there, and there's a lot of destructive wear and tear. So not to mention, this is just the bony structure. We have the ligament, the tendons and muscles that create the motion in your foot, and those get a lot of, again, excessive wear over time that can cause them to eventually fail. And if they fail, then you have, obviously loss of the ability to create an arch, and you just kind of bottom out, and that foot obviously doesn't function very well, and that's painful, not to mention.
Now, if you find like you use an orthotic either to prevent injury or to maybe correct, will your muscles adapt to having your foot corrected and then start to strengthen in the way that it should so that you wouldn't have to wear orthotics all the time?
That's an outstanding question, because what's happening is there's certain, the number one name of the game of gait is to get that big toe down on the ground, and that's why the gait compensations happen, because remember I mentioned the toe in, the toe walker? They're trying to find a way to get this big toe down on the ground, and that's the most important function. And so there are muscles and tendons that create the function that make it happen properly. And as we talked about the orthotic, and what it does is we're trying to create that slope. There's this ideal slope in the arch that these middle bones here, when they flatten out, they become loose like puzzle pieces that move around. When the arch is intact, these guys stay tightly knit, and they become a rigid lever, which allows us to toe off on the ball of the foot. So when they become sloppy, that's where things really break down a lot. So the orthotic is helping to restore that slope to make sure the puzzle pieces stay tight, and also the muscles and tendons that help create the function of getting the big toe down on the ground, for example, and stabilizing that middle of the foot. They are optimized, and that's the reason for the different appearances and keeping the ski slope, if you will, of appearance to make sure that big toe functions properly. As you see here, the cutout for the big toe as well, and also in the extremely flat-footed person, you see that as well here. And finally, you also see that some of these are actually a little bit wider in appearance. And the reason for that is if this is a flat-footed individual who tends to come down on the Fred Flintstone type broad, fleshy foot, if we put them in something that has a higher, more narrow shape, that broad, fleshy foot would basically get pinched right here. So these, on purpose, are wider. We call this a flange. That's flared out a little bit to give them room to come down comfortably without pinching or causing skin irritation, as we talked about the diabetic foot and why that's so important. But for anybody, we don't want to cause any blisters or problems with that, and it's more comfortable. So there's a lot of consideration that goes into each foot type and the device that's assigned to that particular foot type. So it's
so that wearing the right type will help to strengthen the muscles that have been either overcompensating or not used well?
It will help them function better. You still have to do the work with therapy, for example, to strengthen muscle groups, and again, that goes up the whole kinetic chain of events. And this is why strength training, cardio flexibility are also other components that are very important to overall health and well-being. You want to make sure you address those. In addition to balancing your tires here, we want to make sure everything else is working well for you. So it's a collective and or team effort in terms of different modalities that you might want to use to feel your best.
So we don't really have to wait until we get an injury to benefit from orthotics?
We do not, and this is an excellent point here we mentioned that you're inheriting your foot type. So those kids that tend to be flat-footed, for example, by the age 2 or 3, they should be starting to develop their arches. And if they're not, again, if you look at your family line, somebody who has an adult or other relative that have very flat feet, chances are that child is going to have a flat foot, and they are not necessarily going to outgrow that.
Right.
So you should be concerned as a child if your child has flat feet, because again, if we look at some of the wear patterns of that foot, it can be extremely destructive as they get older. Not to mention the fact that the kids that have flat feet that don't necessarily want to be active because their feet hurt, these are the same kids that often are obese or overweight. So there's this sort of profile of individuals that can certainly be helped and prevented. So orthotics not only are helpful in treating acute problems that people may have, but they are also preventative.
Can you explain a little bit about the general categories? I mean, you explained about the low arch and the high arch. Those are basically the only two categories that I really know about. And here you're saying that there's 24. So what would be some other things that, as we, after people see the show, they can look at their feet and say, honey, I wonder if, what category I fall in?
The 24 foot types that you probably are going to see on your screen now is basically giving you pictures of what those foot types look like. And as you look at that profile from 1 down to 24, all those feet in that picture are all left feet. So you can appreciate what's different about them in terms of their heel position, what their forefoot looks like.
Like if their foot's turned in or turned out, high arch or flat.
Correct.
Yeah,
and what we look at, what their arch height is. We look at their gait pattern. We look at their callus pattern. And so there's a number of different things that are telltale in terms of what kind of foot type. For example, somebody who, as you characterized, the John Wayne Walker, for example, they have the wide, kind of toe out sort of gait, or a Donald Duck type of thing. And it's a functional adaptation based on what their foot type is, that they're doing that. So it's not as though they're trying to be cool or different or whatnot. It's actually a functional move. Another example, kids that I mentioned that were flat-footed, for example, sometimes you'll see kids in toe or toe walk when they're kids. Those actually are kids that truly have a flat foot, but because what they're trying to do is become more efficient to getting that big toe down on the ground, which is the whole point of gait. So what happens is those kids are actually toeing in to become more functional and to move faster, but as they grow and get heavier, they outgrow that pattern because it becomes more effort and difficult to do that, and then they just settle into their flat foot type. So that's another gait adaptation that they will show. So there's a number of different things that.
So if someone has a bone-on-bone at their knee and they had some surgery or something, could that be a result of the impact that their foot is having worn down their knee like that?
Absolutely, because what happens too when somebody's got a toe out gait pattern, okay, we call that an angle of gait. And if we look at straight ahead, we're moving straight ahead, but if the feet are sort of angled out, think about, we're moving straight ahead, but our feet are pointing at an angle such as this, at a 45-degree angle, whatever it might be. In order to move forward, we have to internally rotate everything. The foot's going to drop to the inside or to the middle, or the arch is going to flatten, and your shin and your knee are also going to follow that line of pattern. So you get a lot of what we call internal rotation. And that, yes, that can change the alignment pattern of your knee and affect your hip and back and other areas. So it's definitely an overuse sort of pattern that, you know, if you think about it, what we're really addressing is what kind of, to use an analogy, what kind of tires do you have? Okay, how can we best balance your tire to make sure that we are minimizing the stress and wear and tear? And that's just from birth on through the, you know, the many years that we are fortunate enough to live.
So here are some orthotics here. Can you tell us a little bit about the difference between these? I know these are different sizes, but they also look to be a little bit different shaped.
They are, and the difference is from the things that you buy at the drugstore. Many of the foot problems are plantar fasciitis, bunions, hammered toes, shin splint problem, knee pain, hip bursitis, all those things that are happening up the kinetic chain of events. A lot of the over-the-counter store-bought products are not very effective in treating those things because they fall under the category of being accommodative or very soft and flexible. They may be shock-absorbing materials, but they are not supportive. And so if you can bend and twist and, you know, do things to that device, even if it has a little bit of plastic to it, which a lot of the products will say they, you know, are orthotics. But if you can take that plastic material and bend it in your hands or fingers, remember, you're trying to support body weight plus your activity. And running can be 5 to 8 times your body weight. So do the math, you know how much you weigh, apply that stress, and that's how much this, you know, product needs to hold you and support your foot and prevent it from doing something that's faulty in its mechanics. So what's different about these products, which is a line of corrective but prefabricated devices, it is taking into account what your foot type is. These are all very different in terms of the depth of the heel portion of that to try to control the heel, what it's doing, the slope of the arch, because one of the main important points of gait is to get the big toe down on the ground. And when we saw the high arched individual, if you look at that foot again, basically it's got a problem with the big toe being down on the ground and just sort of angled like this. It's as though that big toe were a kickstand on a bike, and that kickstand is making it too long and it's making your bike tip over. So the reason for this is for the big toe to be able to come down and balance off your kickstand and make the bike more balanced. So that's addressing that high arched foot, and it's very different than something that would be store-bought. The store-bought products have no consideration to, hey, you have a high arched foot, I have a flat foot, and we have something in between. And that's why it's not very effective in treating a lot of these problems. So you can see that this one's longer than some of the other ones. Mm-hmm. And that's also by design because depending on when we look at foot types, we're looking at the relationship between what the rear foot does, whether it can, because we always heel strike on the outside of our heel. That's a normal wear pattern. Then we go into our mid stance and then we get into a toe off pattern. That's a normal here, outside towards the middle, and then off the toe. Okay? And what happens is that we're looking at the relationship of this rear foot to be able to go from outside, get down so that it's perpendicular to the floor or not. But a lot of folks actually are stuck out here. And so that means they have to be able to lower that as well. So then we also take into account not only the rear foot, but what the forefoot is doing. And is it in its neutral position? Is it up here, even, or down? And so if somebody's got a foot position that's sort of stuck up here and not very flexible, they have to get all that all the way down to the ground. So there's a lot of this motion here. And the person, the John Wayne walker that has to toe out, does so because it's faster and easier to get that big toe down on the ground. And that's the gait compensation I was mentioning earlier. And so for this person here, the forefoot is more in that neutral position, so they don't need correction. What the longer devices are doing is actually addressing something that may be going on in the forefoot. For example, this one here, all these here on the table are actually left feet. So notice that there's a cutout for the fifth toe, and there's something underneath the first big toe here. And that's because, again, what's happening is instead of having the toe come down to the ground, which is the faulty mechanics, we're bringing the device up to it to meet it. So we're bringing the ground up to them so they don't have as far to go to, put the foot down on the ground, which is the whole point of an orthotic. We mentioned balancing tires earlier. What we're trying to do is make sure that we are offering the proper correction for the type of foot that they have. And so therefore, that's why each device should look different based on what kind of foot you have, and not be the one type fits all, nothing different about it except for the size. And that's why a lot of those problems are not resolved because of it.
That's great. So how much do these usually run generally? I mean, is this something that most people can afford, and does insurance cover it?
That's the nice thing about these, because they have very corrective features to them compared to anything that you buy over the counter. And the thing is that it is affordable. This is sort of an intermediary. It's not the most inexpensive product out there, but it also is sort of the middle of the road in terms, because the next step would be something that is actually custom made for a patient. And there's a number of reasons why something like that might need to be done, or the preference of the patient, of course. But these generally will run about $150, which or somewhere, and that includes, $150 to $200 would include the evaluation and the product itself. So
you know which one to do. And how is this used with diabetics?
The diabetic foot is extremely important, and the reason for that is because diabetics are at high risk for having sores or wounds that don't heal, because part of the diabetic profile is that they have usually a problem with circulation and or sensation to their feet. And somebody who doesn't have good sensation to their feet, for example, doesn't necessarily know that a shoe may be too small. So they're pushing a foot that's bigger than the shoe, and there's a lot of rubbing and friction going on. The other thing, too, for the diabetic patient, that if they don't necessarily have good sensation. So, for example, if they have a stone or something that's gotten inside the shoe and they don't know about it and they step on it and they have no idea that pressure's there, that can create a sore or a wound or even blisters. And the problem is, once they get a sore, they have difficulty healing, because to heal wounds you need good circulation and actually nerve innervation to help bring all the agents that help heal. And when that's all compromised, what happens is those wounds take longer to heal, or they don't heal, they become infected, and then things that become infected often have to either be surgically dealt with, and oftentimes that leads to an amputation. And unfortunately, research shows that once the diabetic has one amputation, it's often within 5 years that they may have another one, because
so then it's even more important to
protect the diabetic foot, which is why we have this other thing here, because this is just a special material that is very conducive to offering relief for high pressure areas. So one of the things that we look at when we look at a diabetic patient is that we take an impression of their footprint, and we're trying to find out, hey, where are the high pressure areas that we need to offload, because anything that is darkened like that will have the potential to develop those calluses we mentioned, and calluses that start to get really thick and move can create blisters that now you've got a sore. So we want to make sure that that foot is protected. And this is a special material that is unique to a diabetic insert that helps reduce that friction. So part of the diabetic care is the proper fitting shoe and the inserts that go with it.
And these fit in really most any shoes?
They can, and one of the things that we're looking at here for shoes is having a removable insert or depth. So a diabetic shoe, for example, would have the ability to have something that would come out. Now, an athletic shoe by nature has more room in it because the insert or insole can come out. And so that's where we're talking about having something that you can remove and therefore put your orthotic inside. And that's what we're really after, is to make sure that there's enough room. Think of the forefoot as being sort of the roof.
Right.
And if you don't have in a casual or dress shoe, that roof is going to be very shallow. So if you try to put something in there and put a foot on top of that, then you run the risk of having a lot of friction on the top of the foot, which is really a problem for a diabetic patient, for example, but for anybody. One of the things that a lot of people have hammer toes or bunions or nooks and crannies and things that, again, can be genetically inherited, but they're also prevented or treated by having proper foot alignment and mechanics to prevent them from getting worse. So folks that have had bunionectomies or bunion surgery, for example, may fix the problem for a short while, but getting back to what we started with, the mechanics of the foot, if we don't fix that or correct it or minimize the stress patterns, the same sort of things are going to develop over time. So we want to make sure that we're addressing that. So shoe fit is really important, and making sure that you match your foot to the type or the shape of the shoe is really important too.
You work at the Toby Hospital ER with surgeons, not the ER, but the surgery. You do surgery as a technician with orthopedic surgeons. What is your role in that?
Basically, I help in the operating room with the orthopedic surgeons. When we have a case, I help or assist in them with the procedure. I help prepare the patient before the surgery, before we start the techniques, and then once we've started that, then I assist the surgeon in terms of wound care, retraction and different cautery, different types of things like that. So anything that goes along with the procedure, I'm there to offer assistance or help as the procedure goes along.
Do you do any post-surgery care as far as helping with physical therapy or recommending helping them get fitted with, orthotics to prevent further injury?
It depends. Like yes, I do. When they follow up in the office, I'm helping out with the wound care and the post-op care and home exercise programs when that's appropriate. And
do doctors refer patients to you for foot care? Do like chiropractors or even primary care physicians notice that, gee, maybe this patient would benefit from orthotics to either avoid or repair something
Absolutely.
That's going on in the body?
And as I mentioned, it's also, it's not a function of just acute injuries, but also preventative care and for the diabetic patient. So yes, there's a number of specialties that might look to refer to there's care like that.
Great. Well, thank you so much for all this information. I think it's really important that people understand that they can either prevent injuries to their bodies or correct injuries and change the way that their body moves every time their foot hits the ground by using orthotics.
Thank you very much. I appreciate the opportunity.
For more information, you can contact Dr. Jeanna Polonchek at 508-295-8800 or email her at soulremedyllc@yahoo.com. Thank you for joining us today. I'm your host, Jackie Bell. Join us next time on Living Healthy.